Hi, good morning or good afternoon, whichever one applies to you, wherever you are in the world. I've been asked to cover my experience with major abdominal surgery. And for me, in 2016, I underwent a laparotomy, which was a vertical incision through the abdominal musculature, so straight down the middle of my abdomen. This was to correct a twist of the small intestine. Having discussed this with the consultant, he actually said to me that he had no knowledge as to why it happened. There was no tumour or blockage, which is the usual reasons for a volvulus to occur, the volvulus being the twist of the bowel. It began for me, I think it was on a Tuesday night, where I ate a meal and then just started throwing up, thinking I had a bug or food poisoning. But a couple of days later, was still throwing up, ended up throwing up blood. So obviously knew something wasn't right there. And this was diagnosed as a volvulus. So I was put in for emergency surgery. Luckily here in the UK we have a fantastic NHS, so I was taken through very rapidly, and I had an amazing surgeon who did the surgery on me. I did go from 13 stone of lean muscle to 10 stone in 6 days, so it was a drastic weight loss. But you could say it was a close to death experience, so I can't complain about that, and I was able to do my rehab afterwards. The fact is I'm here. But one thing I did notice quite a lot, because whilst I was laying in the hospital bed after the surgery thinking of how I was going to do my rehabilitation and what I might be going through, was I went online and actually there was very little on YouTube or online to actually tell me what to expect. And this is why I've had some people contacting me asking me to explain recovery from abdominal surgery. Now, abdominal surgery is major, be it a C-section, a laparotomy, or any other abdominal surgery you may go through. So the recovery can be long. That's the one thing I want to tell you first. And one thing I would also say is, whatever time frame you're given, be kind to yourself. Give yourself more. I was told that my recovery from a laparotomy would be about 8 weeks. With the job I do, which is very physical, I can have clients ranging from 12 stone, 8 stone, all the way up to 20, 24 stone. I can also have 6 or 8 clients, very muscular. And so for me, I felt 8 weeks was never going to be enough. As I say, I lost all my muscle. I went to effectively skin and bone. And so I wanted to be kind to myself, and I gave myself 12 weeks. And then when I did come back, I started on a very low number. So I would, previous to my surgery, see anywhere from 12 to 16 patients a day. And I came back at 6 a day with lots of gaps and not allowing myself to treat my larger or clients that needed more energy input from myself. And I built that up, probably over the month or two, a bit like you would any kind of injury that you're rehabilitating from. But in terms of the actual surgery, so what did I go through? I'll probably cover this in a few stages. So today I'm going to cover the actual surgery and the immediate days after the surgery and what I went through, which can be a quite interesting story. So I was rushed in from the walk-in. I was taken to A&E. Here in the UK we have an amazing NHS. So they just dealt with me. They took me through. I was scanned with a CT scan because they thought I had kidney stones, possibly because the pain was excruciating in my back. The only thing that had eased any of my pain was a 10 ml dose, I think it was, of morphine. Who knows, I was so out of it, but I think it was a 10 ml dose of morphine. I was immediately catheterised and I was given a tube down the nose, and that was to clear the gas from my from my stomach, because obviously with the bowel twist it stops anything going through. Think of it as a tube that twists. You then can't get anything from one side to the other. So I'd thrown everything up that I had in my stomach, and then I started to produce a lot of bowel and a lot of gas. So that caused a lot of pain. So they would drain that regularly. So hence I had the tube down my nose. I was taken in. I went into A&E. I think it was a Thursday mid-morning. And because me being stupid and saying, is there any chance this might correct itself? I didn't actually have the surgery till the following morning, because I didn't have it in the day on the Thursday, and they preferred not to do it overnight. They would have if it was an emergency, but they preferred to do it in the day. So I think I was taken through, it was supposed to be 8:30 on the Friday, and eventually it was 11 because an emergency came in that was more of an emergency than myself. So I was pushed back, one, understandably so. So as far as I recall, I was given my anaesthetic about 11 in the morning. I'd signed off on the possibility of a stoma bag, of a bag, because in quite a few cases they actually have to resect the part of the bowel that twists, reconnect the bowel, but for a month or so you'll have to have a bag to poop. And when you have that, they'll then try and reverse that, usually at a later date, maybe a month down the line. I was very lucky. My bowel actually was still healthy. So the surgeon said when he opened me up and had a look, he actually didn't have to remove any of the bowel, just unravelled it and put it back in again. So I was very lucky there. Pretty much from surgery till the following morning, so the Saturday morning, was pretty much a blur, in and out of sleep or consciousness. I wouldn't be that sure, I would say sleep. Pretty much kind of tunnel vision just to a clock in front of me, and I'd wake up, see the clock, be told to use the morphine clicker for discomfort in my abdomen and with breathing, you know, wanting to make sure that you could maintain a breath and not get infection. And then, woke up, I think, effectively around 10 on the Saturday morning, maybe 9. At which point, they just wanted to get me out of bed. They wanted to get me walking on the Zimmer frame to the other end of the room and back, which for me was like, excuse me? But, you know, this is part of what you need to do to recover. So I managed to do that. I was still on morphine at this point with the clicker. And me being me, I didn't really like that. I didn't want to get addicted to any kind of medications. And being extremely healthy, clean, whatever you like to call it. Don't take drugs, never smoked, don't drink. I didn't like and I use medication sparingly for situations such as this to save my life, or if I've got a severe flu-y type symptoms and maybe I just need to function because I've got to look after the kids or something like that, then I might take paracetamol. But medications don't tend to do well with me, and so I try to avoid them. But in this situation, it was very, very necessary. And so I think the Saturday night, I'd had some visitors, my wife, my brother, and my best friend, Mick. And then as they were getting ready to go and the night nurse came in, he said to me, "Oh, 137 clicks on the clicker, that's a lot." Which with my brain was like, what? So I said to him, any chance I might get addicted? He said no. I said, but you said it's a lot. And he said, well, it is. So then I was just confused. So I decided in my own wisdom to pretty much go cold turkey overnight. So I went down from 137 clicks of morphine, which had been registered through the day, to 17 overnight. So pretty much cold turkey overnight, which was very, very interesting. So very, what's the word I'm looking for? Fun and not so fun experiences. So I would say for a couple of hours I had what would be, I suppose, akin to a shamanic experience. I was travelling around the universe, visiting different cosmoses, I think that's the word, different star systems, giving me that connection to the energy of the universe, which was very pleasant, but also quite a shift in mindset and appreciation for our connection to everything in the universe. But then following that, I think with the good you always get the bad. And because I was going cold turkey, then I had what could only be described as audible hallucinations. So unknown to any of the nurses and unknown to anyone else, I thought they were trying to kill me through playing around with my drips, my bags that I'd had put up to give me drips through the night. And this was because I'd heard in the next room, or supposedly the next room, that someone had died, that it was very bad medicine, that this is all going to come back on them, and then hearing a doctor's voice saying, well, what about next, a nurse's voice saying, well, what about next door? He'll know. What do we do about him? And the doctor saying, that's easy. We can just sabotage his bags. No one will know. It would just look like antibiotics in his system. I was on morphine, I was out of it. You know, it's just one of those things. But when you think that for the next 5 hours someone's trying to kill you, you can imagine not the greatest position to be in. So I sent some absolute gobbledygook texts to my best friend, just saying if I'm not here in the morning, it wasn't an accident. It was planned, and actually we've read those back and they don't make any sense whatsoever. So all in my head. And I actually apologised to the night nurse the next day when I said to him, I thought you were trying to kill me last night, and he was like, what? But he also absolutely appreciated where I was coming from, said he'd seen people jumping around the room thinking they were angels, and that's what, you know, morphine can do to certain people. But by that point, the next day I was off the morphine, so I was off the drip morphine, I went on to Oromorph, oral substitute, and I was still on my tramadol, paracetamol. And so by the next day I was completely off the Oromorph, so within 2 or 3 days I was clear of the morphine, I just didn't want it. And so yeah, that was kind of the Sunday I had the catheter out, so you'll expect that. If you've got a catheter, then when they take that out, you've got 12 hours, I think it was, to pass water. And if I hadn't passed water in 12 hours, my bladder hadn't filled up and hadn't passed the water, then they would have re-catheterised me. So yeah, I didn't want that to happen. And luckily I did pass water, so that was good. I also went through a bit of a down spell that day. I don't know whether it was infection or what it was, but I was in and out of sleep and being with it and not with it for a good 8 hours or so. And then my awesome wife, she helped me with just getting out of bed, getting moving, not letting me lay around and do nothing. She was amazing that day. So yeah, that was up to the Sunday. So you can see sort of 2-ish days where I'd been moved out from the surgical dependency ward to the actual main ward. And at that point, obviously things then changed. That's where I started looking at my phone, looking for ways in which I was going to speed up my recovery, what to expect, and that's where I was kind of hitting a blank. So in the next video, that's what I'll go on to. I'll go on to that spell from sort of day 3 through to day 6 when I was discharged and what happened in hospital, and then I'll do another video probably as when I got home, and then what to expect from there and the sort of recovery I went through for myself, writing all my own rehab, and how I took myself from that very low space or ebb to a much more active and vibrant person again. So look after yourselves. I look forward to bringing you that next video. Take care.